we consolidated with the Albany chapter of NYSARC. And there was a lot of misunderstanding, I believe, that was generated over years and years of people trying to do well. That the approach to providing services was different than we had instituted a few years ago at the Warren Washington end. And the approach was, why we sought the training, was we wanted to make sure that both areas, Albany and the Warren Washington side, were on the same page when it came to treating people with dignity and respect.
We were inspired by a number of things in 2007, one of which was we worked with George Cease on developing a NYSARC EDA position paper on restrictive interventions and restraints, and worked with Lori Kelly from Ulster ARC, Bill Castiglione from Canandaigua, and we cooperated together for about 6 months in developing that paper, which was to encourage all chapters to seek alternative kinds of positive approaches versus the restrictive techniques.
I worked at the state office of NYSARC, and George persuaded me as a young lawyer to come out and see how things were done in the field. And so he introduced me to Vantage Point, and I got a perspective that actually changed my life. It was one of the reasons why I wanted to become an executive director, to see if I couldn't institute what George had done in Delaware in my little corner of the world. And getting back to Warren Washington, bringing those lessons that George had taught about how you treat people, I initially, when I came to Warren Washington, encountered some resistance among staff. But we worked for many years. We instituted the vision of treating people with dignity, the shift happens philosophy, and we got it off the ground and it worked well. Well, along comes the consolidation with Albany, and we were exposed to a sister agency that hadn't yet found the fundamentals of shift happens and put them into practice. So we weren't going to regress and step back and readjust Warren Washington's side to an old way of thinking. We wanted to be progressive, and so we decided that Albany could use a fresh perspective as well, and we're in the midst of that process and change now.
When we first started working with Del Arc and George, we were working with some people with some significant and challenging behaviors that have had them for years. And again, getting that whole cyclical pattern. And what we noticed within 6 months, that many of these individuals, not only was the behavior either being decreased or eliminated, but the need for physical intervention was disappearing. So so we actually saw pretty much immediate gains for people for long term who were just having difficulties, and the relationships that could be built with the individuals were much easier to happen, and the staff's involvement, clearly their jobs became better.
Really, what makes it unique is that it has pulled together positive approaches and the strategies that are used to really provide an alternative to staff or to us feeling that we have to control people's behaviors. It shows a way to be able to, again, help the individual to control their own behaviors. And a big component for us was the teaching aspect, that we could teach people alternative or adaptive behaviors that would be more of what they would look for in terms of being more self-directed in their own supports and services. So teaching people alternative behaviors was really the biggest part of our curriculum on the second day that we have used it since 2010.
It made sense. It took a lot of the principles that we just tended to forget about in the field and put them together, but added the one component that really drew us to it, and that's the idea of caring relationships. And that was something we were excited about getting into. And at the same time, we were going through the process of Council on Quality and Leadership, And many of the principles that is part of that is about relationships and about respect and getting to know the individuals and getting to know what's meaningful to them. And this became, we saw this as a perfect tool to get to that spot. Part of the Fwdshift was also what we do as administrators and how we conduct ourselves. And what we found to be a real plus is the interview process. We struggled a lot of time with turnover, hiring the wrong people. They would be gone in six months to a year. And we found out spending the extra time up front, making sure that we matched the values and that that they knew what the job was, and we presented them. We got to see them in interaction with the people that we support. That made our ability to keep those staff longer. We're not seeing that turnover. Like the field, we're having a tremendous amount of vacancies, but we're fixing that by having people stay with us once they get the jobs. And we give a lot of credit to the process of hiring that we learned through the Fwdshift.
People would come to work and say, at the end of a day, boy, I got beat up 3 times today. And they would go home feeling worse than they came in. And so we wanted our folks, when they came to work, to go home without stress. Because when they come to work with stress, it has an impact on the folks that they serve. So the easiest thing that you can do is tell people not to touch people in a negative manner. If you don't do that, that's a stress reducer, morale naturally increases, and overall general contentment goes up.
I loved the Vantage Point experience. It was really an eye-opener. And I was confined to a wheelchair for the day. It's very uncomfortable, and really understanding the kind of challenges that an individual would have in a wheelchair. But what was equally impressive, though, was the support of the staff, who were there in a very kind, gentle, nurturing kind of a manner, and providing that kind of praise that we all need, throughout any of our days, in being able to learn and grow.
Just from looking at our data on abuse and neglect, and the physical intervention component, and there's been a massive reduction in incidents that surround physical interventions. And we have seen that over the last 2 years as we were implementing Fwdshift.
When I first came to Warren, Washington, our workers' compensation payouts were tremendous. We were on a retro plan, and it seemed that every year we were paying hundreds of thousands of dollars in workers' compensation payments related to physical interventions. A small direct support professional who would put a wrap on someone and be injured. A direct support professional who would attempt to do a takedown and be injured. And we found workers' compensation costs northward $600,000–700,000 annually. The first year after implementing a full year of eliminating physical interventions, and I'm talking the restrictive type, no takedowns, no supines, and then when we got away from wraps, that first full year, we cut our workers' compensation bill in half. And now, 7 years later, we are running at 10% of what our claims were 7 years ago on a workers' compensation basis with respect to workers' comp and injuries related to physical interventions. If you don't use physical interventions, you don't pay workers' comp claims related to them. And when you reduce your workers' comp expense, it's a financial dividend that has real dollar impact on your bottom line.
In the first year of implementing, creating opportunities for positive relations built around the Fwdshift happens, we saw a 30% reduction in overall incidents, reportable incidents, and a 37% reduction in allegations of abuse. And we saw our workers' compensation claims drop from 9 behaviorally related out of 21 workers' compensation claims to 0 out of 6 after the first year. So again, we have to realize that our staff don't come to work to be injured, and the people that we support don't come to program to be injured. And again, that was the value of not utilizing those interventions anymore.
Well, our workers' comp now is predominantly slip and falls. You're walking with somebody and you get injured when you're walking off a curb. Or if you're in a vehicle accident, there might be a workers' compensation component. But we have not had, in the Warren, Washington end of operations, a workers' compensation claim related to a physical intervention in over 3.5 years. On the Albany side, since consolidation began 2 years ago, our workers' compensation costs the last year have dropped dramatically as we eliminated all restrictive physical interventions here in the last year. So we're reaping that dividend now. We've served an individual who for years, last couple of years, has been a challenge for staff. Someone who was frequently in a supine, a 4-person supine. When we stopped it, the staff's concern was, well, how do we protect ourselves? And how do we protect damage to the walls? How do we protect doors from being broken? And so we got together and we said, well, we know how she responds to physical interventions, restrictive. How would you feel if you were put down on your back and held down in front of your colleagues? You're going to come in the next day and you're going to think it's going to happen again. So why don't we try something novel? Why don't we eliminate it? And so this particular individual was a challenge for the team because they thought this is the case where the philosophy of forward shift and shift happens fails. And just the opposite occurred. When the individual showed what we would consider some maladaptive behavior, we didn't care if something on the wall got broken, as long as the individual wasn't harmed. If it was a health and safety issue, we would have addressed it differently. But this was an individual who wanted, through their actions, to demonstrate that they were in control of some aspect of their lives. So we let them be. And we found that as they were able to express themselves and there was no negative consequences, the behavior dropped. And so an individual who we were ready to transition out to another provider's day hab is doing very well here now.
We initially had some very challenging behaviors, and they were cyclical over a period of time. We have seen significant improvements in those areas, and the physical intervention aspect of not having to do it and not having that need is beneficial to everyone involved.
It's been 5 years since we have developed our curriculum to support the individuals that we serve. So it's really become embedded in our culture in terms of dignity and respect. You can see it in the interactions between the direct support professionals and the people that they serve. You can see it in the interactions between those individuals and the staff who support them. The use of praise is very powerful in supporting the kinds of behaviors that you want to see increase in the future. So we have the individuals that we support are giving staff high fives for the good work that they do, the kind of supports that they share. So it's been wonderful that way, and it has made us a kinder, gentler, more person-centered, more supportive organization in what we do, and it's helped to further our mission along the way.
We've become CQL accredited, and we see the forward shift as being a tool in order to apply some of those principles to get to know the people that we are supporting and to what's meaningful to them, and meaning our goals in terms both for our core values, our mission, and our accreditation. One thing that we noticed was that the staff are far more looking at the functional analysis, looking at data, to try to find out what's creating the behavior, or really using, like I said, using data to know what the cause is, the root causes, and then it allows us to much better respond to those situations, and we're seeing that use in the forward shift programs.
I have been called by colleagues who have asked me if the training that George provided was beneficial. My response every single time is absolutely, without question. We've been able to quantify the benefits of the training in 2 ways. One, personal satisfaction increased morale, lower need for any type of physical intervention at all. And two, financial. The financial payback of the implementation of the Shift Happens philosophy and Fwdshift in totality has generated financial dividends to the agency that pay for itself. And I can demonstrate that to fellow execs who, for no other reason than financial, should be interested in the training.
There's been continuous improvement in the training that is taking place. It's very well organized. George Cease is a very engaging presenter. He helps to put a face on what this really means to an organization and to the people that we support. And I would highly recommend it, and I have repeatedly at every opportunity. It is, again, unique. There is nothing else out there that pulls together the behavioral approaches and the concepts in a way that is understandable, comprehensible, and replicable.
I think that the training programs are unique and they're wonderful. They're good for an executive director and a senior management team that wants to do things differently. If you want to get away from the traditional operational mold of controlling people through physical interventions or negative reinforcements, the training that Delaware ARC offers is phenomenal. It really changed the way that we thought, it changed our perspective, and it works.